My main awareness after working in Africa, in Mozambique for 2 years, was that the economies locally and the cultures locally were embedded into global systems, and that it was impossible to change dramatically what was happening on a local scale without resetting the rules that regulate global, international, primarily economic systems. In the mid-'80s, I was trying to understand how global systems work, and it turned out that algae, the vegetables of the sea, as Rachel Carson calls them, because they produce oxygen and sugars, were part of the global system and helped regulate the temperature on Earth by seeding clouds and so on. In the late 90s, work revealed that plankton, algae, could harbor cholera. And so when the outbreak occurred in '91 in Peru, it looked as if warming of the oceans affected algal populations and had helped initiate a cholera epidemic that spread throughout Latin America. I reported this in '92 at the Rio Summit, and no journal picked it up except one journal, the Wall Street Journal, because they saw that cholera had affected shrimp exports and tourism. And so that began me on this path of climate, disease, and economics. In 1993, I co-edited a series on global change and health for The Lancet, an international health journal based in Britain. And that helped bring together a community of researchers from Honduras, from parts of Africa, from parts of Asia, Australia, and Europe, and the US, that later helped set the stage for a World Health Organization, United Nations Environmental Program group to look at climate change and health. That group then wrote the chapter on health and climate change for the Intergovernmental Panel on Climate Change, their report in 1996. So this helped put the issue on the map.